Viewers, welcome back to the Demystifying YouTube channel. This video will teach you everything you need to know about your PAP test.
Paula, who has just turned 22, is sexually active. She lives in Ontario and visits her family doctor for a routine exam. During her visit, Paula's doctor advises her to get a PAP test done. Although Paula doesn't know what the exam entails now, she remembers learning about it in her middle school health class. Paula's doctor goes on to explain to her that the test is meant to look for HPV in the cervix and cervical cancer. Paula becomes anxious because she is fearful and uncertain about what to expect. So let's discuss it. What to expect during a PAP test. In an attempt to calm her fears, Paula returns to her family physician and asks to learn more about HPV and cervical cancer. Her doctor explains, "Our body is made up of a lot of cells that divide and develop through biological processes, but sometimes these cells begin to grow uncontrollably. This can occur anywhere in the body and can spread to other areas. This is what is known as metastatic cancer. The cervix is located between the uterus and the vagina. Cervical cancer originates in the cervix. Cervical cancer is caused by HPV, and HPV is a virus that is transmitted through sexual contact." Paula worries about this because she is sexually active. Her doctor emphasizes that HPV does not always lead to cancer. Only chronic infections with high-risk HPV can result in cervical cell mutations. This process could span years or decades. But even before that, there are several strategies for preventing HPV. This involves immunization, safer protected intercourse, and in particular, routine screenings such as the PAP test. Cervical cancer can also be benign, which means this cancer does not spread to other parts of the body. Paula is more confident in getting her PAP test done since she thinks it will benefit her in the long run. She schedules an appointment with her nurse practitioner to get her test done. Her nurse practitioner advises her on several points to keep in mind before her test. This includes not having intercourse for 24 hours, not using any vaginal drugs or creams, and not scheduling your visit during your menstrual cycle. During a PAP test. Paula enters the exam room and places her heels on the stirrups for support. A speculum is inserted into the vagina. This tool's purpose is to separate the vaginal walls so that the cervix can be examined. At this stage, Paula feels pressure in her pelvis. This is normal. The nurse next collects a sample of cervical cells with a gentle brush and a spatula. Paula is not in any discomfort right now. Now the procedure is finished. It only took a few minutes. Understanding your test results. The nurse will send the samples to a lab either in a container with a specific solution or on a glass slide. A lab tech will examine the sample under a microscope to see whether the pattern or structure of the cells indicate cancerous traits. A PAP test result might be normal, unclear, abnormal, or unsatisfactory. A normal result indicates that the test was negative, which is excellent news. This suggests that the cell pattern exhibited no abnormalities. An unclear test result indicates that the cells somewhat look abnormal, and while it could be related to HPV, it is inconclusive. This may be related to something else in the reproductive system, such as an infection. The nurse should provide next steps should this happen. Next, abnormal test results indicate that the cells look different. However, this does not directly mean that the individual has cervical cancer. It could be due to HPV. It could also indicate precancerous cells, and these cells can become cancer over time. Further tests must be conducted to clearly indicate what the issue is, but it is important to remember that the earlier the cancer is detected, the easier it is to treat. Lastly, unsatisfactory test results mean there was not enough sample collected. In this case, the doctor would request you to return for another PAP test. Fortunately, Paula's test results came back negative. Great news. This is a result of Paula's healthy lifestyle, which minimizes her cancer risk. She was immunized against HPV throughout her preteen and adolescent years. She does not smoke, and she only drinks on occasion. Furthermore, Paula and her boyfriend always use protection during intercourse. She exercises daily and eats healthy, ensuring to eat enough fruits and vegetables. Paula's nurses inform her that her PAP test needs to be done every 3 years until she turns 29. After the age of 30, she will only have to do it every 5 years until she's turned 60. So we'll see her then. We hope you learned something valuable in this video. Please remember that this video is for educational purposes only, and you should always seek advice from a healthcare professional before taking any medication. Thank you.